I am joined by I am English. I am joined by my good friend Richard. Let's try that again. Hello, Richard.
However you is it, and it's good to see you.
Yes, well, fine. Now, let's jump straight into medical stuff. If you've got a question for Richard, you can let us know. Dr. Richard Scott was a GP for many, many years, now recently retired. But if you've got a question on the news, on the topics of medicine, health, anything you've seen, you can send them to us. We'll put them to Richard. He will do his very best to answer them. Email hello@pure247radio.org, hello@pure247radio.org, and then you can get in touch with me and I will ask Richard on your behalf. Richard, what have we got for today?
Well, very kindly, you sent me, and I think from a listener, a podcast.
Yes.
And I think the message was, perhaps this would be of interest to Richard. So I thought, well, that's good. So I set aside whatever it was, 35 minutes to listen to this podcast, and it was a good one. And it's about alternative medicine. Which I have to say used to be a particularly controversial subject, perhaps a little less controversial for doctors nowadays than maybe 30 years ago. But there's still plenty of questions which this podcast tackled. Namely, number one, is alternative medicine effective? Number two, is it safe? And number three, are the claims that are made proven by science or not? So that got me thinking. And obviously, I come at this topic from a conventional medical background, but you might think, well, is this topical? Is it in the news? Well, it is, in the sense that a book has been produced, which I'll come to at the end, by the author of this podcast on alternative medicine, and he was really worth listening to. So I thought I'd summarise what he came up with, and people can get the book at the end if they like. But I thought I'd summarise what he came up with. Because I come from a conventional medical background, and I have to say, 40 years ago or plus, when I was at medical school, we were not taught a dicky bird about alternative medicine. It sort of existed a bit, but certainly we didn't have any teaching. Hopefully now, younger medical students will get some teaching, but probably not a huge amount. And I've learned stuff along the way. But I have to say, even when I was a medical student, I went to Nepal on my Christian elective, it wasn't a Christian elective, on my medical elective. And I watched an operation, a major eye operation done under acupuncture. Now, I've done some minor eye surgery in A&E. You anaesthetize the eye, you drop in some local anaesthetic drops, and when the eye is done, then we remove usually foreign bodies from the cornea, welded on through a welding accident, usually because people didn't wear safety specs. Wear safety specs if you're welding. However, this was a proper eye operation, and a needle was inserted deep, and I mean about 5 or 6 inches alongside the eye into the brain. The person never felt a thing when the needle went in, and they never felt a thing during eye surgery. And I thought, I can't explain this, but boy, that works. Can you imagine near an eye with a needle or even a knife without proper anaesthesia? So whilst I didn't understand how it worked, there's no doubt that it did. So there we go. So that's where I come from. And since then, I've had some acupuncture myself, just on minor things, elbow and calf injuries, where acupuncture seems to have helped a little bit with my treatment. I can't prove that it did or didn't, but I can tell you that eye operation took place under proper anaesthesia. So I come from that sort of open background. And patients used to mention stuff to me from time to time. But this podcast was produced by a man from a theological school within a United States university. And he was both a scientist and a pharmacologist, but also a Christian. And he'd done his research, his PhD, on herbal remedies and the active ingredients within, I think because his dad had been a pharmacist. So he's a clever guy. This was his PhD topic, and he spent 35 minutes looking into it. But the question he asked himself, which was a really good one, perhaps all of us want to ask ourselves the same question. How does God fit in with my training? In other words, whether you're a pharmacologist, a butcher, a milkman, a radio presenter, a doctor, how does God fit in with what I do? And he became well known in his field. So an organisation which I'm well aware of, called the ICMDA, the International Christian Medics and Dentists Association, who I've been a bit involved with over the years, approached him for advice because their members, people like me, doctors, were being asked questions about alternative medicine and couldn't answer them. So he came up with some stuff. So I'm going to summarise what he talked to us about on this podcast, and which he obviously writes about in his recent book, because it'll help not only doctors but also listeners to your programme, Andy, decide about supplements, dietary products, and other areas of medicine which aren't conventional and therefore labelled as alternative. Now, here's the definition. I like a definition, and there isn't one. What is alternative medicine? Well, it's not precise because it's a moving topic. Initially, it was anything other than what you would get from your doctor or a hospital. But even that's become tricky because often alternative medicine has become normal medicine, incorporated within Western medicine. So nowadays, we sort of think of it as anything that's complementary or holistic, separate from what can be medically prescribed. So I can't prescribe it, but it's still useful. Now, often they have a plant or a herbal source, to the extent that you might even see some plant material mixed in with what you get. But also, this is important for Christians, it often has a spiritual root, including Reiki, including yoga, meditation, mindfulness, usually linked to Buddhism, sometimes Hinduism. There's a huge mixed bag here, but that's important when we look at alternative medicine, and we'll go into that in just a second. Equally, the way substances are viewed changes over the years. Marijuana has gone from being absolutely alternative to being pretty mainstream. And don't forget that 50%, and this is a good statistic, 50% of mainstream treatments today came originally from natural sources. Aspirin, for example, came from willow bark. But these things have become modified to make them more effective and to regulate the dose. So I thought I'd start, Andy, and you'll like this one, with 3 popular misconceptions. We'll see if you sign up to any of these. But number 1, and this is the big one, if it's natural, it must be safe. So I'll pass the one over to Andy. If it's natural, it must be safe. Leaving natural methods of contraception out, because that suddenly occurred to me, clearly not safe. What's wrong with that? If it's natural, it must be safe.
AC, I go at a bit of an extreme, but what's the little octopus thing that kills you that's teeny tiny looking blue? I mean, that's natural. It's not good for you.
Mm-hmm. Thank you. There's one. Absolutely. I mean, the idea is this was a sort of counterbalance to, the big bad drug companies pushing out nasty drugs with side effects. But the natural world is full of poisons. If you watch any wildlife programs, especially if it touches on Central or South America, these poison frogs, you can't even touch their skin without dying. That's why they're bright colours. Strychnine was originally natural. Anyone who reads an Agatha Christie book, that was her favoured method. Hemlock, that Shakespeare used to talk about, lethal stuff. Actually, funny enough, I was seeing some hemlock growing in ponds in Wiltshire this past weekend. It's growing freely. Very, very dangerous. Just a small, couple of inches will kill you if you eat it. So there's all sorts of things. Foxglove. If cows or horses eat too much foxglove, it kills them because it contains digitalis, which we use to strengthen the heart and slow the heart rate down. Eat too much and your heart rate will slow down too much. You'll kill yourself. Digoxin comes from digitalis, comes from foxglove originally. So, natural things does not make them safe. And also, of course, the spiritual link can be evil. So we need discernment. Number 2, this is rather nice. He tackled, what does it mean to be healthy? This is really worth thinking about as Christians, because both medicine and alternative medicine aim to restore health. But a biblical view of health differs very much from a cultural view of health. So the Bible talks about health as being healthy, as flourishing in the image of God who made us his way. And whereas a cultural view is all about physical and mental health. Now, in Scripture, there may well be aspects of our physical and mental health that aren't going well. We think of Job or Paul's thorn in his flesh. Equally, more in modern days, Joni Eareckson Tada, who was quadriplegic after a diving accident as a young lady. Absolutely spiritually flourishing while she can't move her arms and legs at all. Can only use her mouth. So these are people who can flourish in God's terms, but aren't flourishing in cultural terms. See, it's not about strength or beauty to God, but about our spiritual well-being. And of course, as our bodies deteriorate with age, God may use our limitations to deepen our relationship with him. He may, of course, allow us to be restored through treatments or surgery. But yeah, what does it mean to be healthy? So that was a clever aspect. And number 3, worldviews. So this is what we're talking about, the worldviews associated with alternative medicine, because some undoubtedly conflict with Scripture. Take Reiki, for example. Several Eastern worldviews will link users to spiritual guides. And this is a dangerous way to combat disease. Yoga and meditation, of course, have a Eastern religious basis with energies very much part of the package. We can look into both of these too if you want a bit later on. But these things are not good for us, and we're warned against them because they could link us in with spiritual beings, which are bad, evil spirits, if you like. So beware. And if you're going to get involved with yoga, or, for example, you need to know, is the spiritual side involved or not? This was a question I had to answer in my practice about acupuncture when we employed an acupuncturist who just focused on, if you like, on the Western aspects of acupuncture. She wasn't involved with the Eastern aspects, i.e. the spiritual basis behind it. And if you have a yoga teacher, for example, if any of our listeners do yoga, well, you need to find out what your yoga teacher is trying to expose you to. If it's nothing, okay, I still wouldn't recommend it personally. But if she's trying to expose you, he or she, to the Eastern spiritual aspects, I would leave it well alone. It's not good. Not good for us. I thought I'd look at supplements, Andy, because Heather, my wife, has just taken another one. Most people take 3 or 4 supplements as we get older. Heather's just started taking collagen for her thin skin and fragile capillaries. You only have to sort of rub your arm up her skin and she bruises. Adds this to omega-3. Which we're told, wards off dementia as you get older. That's well worth having. And plus a couple of standard medical pills. And my question about supplements is the same one that this guy tackled. Do they help? How do we know if they work? Well, this clever chap, who we'll go into at the end, on his podcast, he looked into it and found the most reliable organization. And some of the listeners might want to jot this down. It's called consumerlab.com. consumerlab.com, the most reliable source of information from a scientifically independent lab, looks at studies on all these remedies, herbs, supplements, and also tests them themselves thoroughly. Then, if the research indicates that, say, a particular supplement works, what brand should we buy? And this is really complex because there's so many. Most are not regulated by the FDA in America. Most make claims which are not proven. There's no regulatory oversight, as I've mentioned. But the lab, this consumer lab, will still buy and test them to check, for example, that if a product claims to contain 5 milligrams of a chemical, well, does it? How much does it actually contain? And finally, look very briefly, before I finish, on psychedelics, because there's a huge cultural push at the moment, moving mushrooms, for example, towards the normal, so that there won't any longer be alternative. But again, is there any real place for these substances? Well, a very tough question, he said, because many drugs that started as alternative medicines have become mainstream. I mentioned marijuana, but also opiates. Now, these are powerful substances with definite benefits, but very concerning side effects, along with any spiritual aspect to them as well. Mushrooms powerfully affect people's brains. There's a potential for help. But if they go forward unregulated without an evidence base, we risk a serious outbreak of adverse effects. So the good news is there's some research going into mushrooms too. The aim of all this is to produce versions of these powerful substances with a known amount of the active ingredient to avoid what's otherwise Russian roulette. Because as ever, these alternative medicines have potential, but care is required. So I mentioned that a book has come out. It's called Alternative Medicine - The Christian Handbook, or in some areas it's called Alternative Medicine, The Definitive Guide, by an Irishman called Donal, Donal, O'Mathuna, O apostrophe, big Mathuna, Donal O'Mathuna, and there's a lovely American name, Walt Larimore, Larimore. And this gives you a critical, evidence-based and Christian perspective on alternative therapies. So it really got me thinking, don't discount them, but we need to know more about them, what really is safe and what isn't, especially if these things are going to become mainstream. And if they aren't mainstream and you're buying them over the counter or even worse online, do some homework first.
I'm going to jump straight to a pharmacy grade heart medication that I take. I've forgotten which one of the two it is, because I take 2. Anyway, we went to the pharmacy. I was given my prescription. Every time we went, it seemed to be a different box, different brand. And the pharmacist said, well, they're identical. That's fine. Anyway, one of them I am absolutely going to state is not the same. The pharmacist there It's the same, sir. It's the same ingredients. No, because one of those almost sent me to hospital. That's impossible. No, it really is. Because there was some chemical within the thing that was not listed. And when you looked at the ingredients, he was right. They were literally, and one after the other, identical. But something of a binding agent, I would imagine, that holds the tablet.
The extra stuff around it, you're absolutely right. So it's not just the active ingredient. What else is in the tablet? Absolutely.
So we go now. We are not having this medication, and we haven't quite got into a fight with the pharmacist. But sometimes they're, how do I put this? They seem rather confident about things they can't know.
Sure, and they're just concentrating on the active ingredient and forgetting the rest. Sometimes. Thank you for educating him.
Well, we do this mostly because I almost went to hospital because it really had an adverse effect. Because I'd not had it on anything else, we now say, not this one. And it's the one that seems to be the easiest to get hold of course it is. Well, it's here, it's the same.
And for most people, it will be fine.
Yes.
But no drug is fine for everybody. And as you say, sometimes it's the active ingredient. So nobody could take any of them. But otherwise, it's just the extras around the edge. We used to find that with eye drops, the preservatives would often upset people, even though the actual active ingredient, chloramphenicol, antibiotic, for example, some people needed it preservative-free. Otherwise, they couldn't take it.
Yeah. Here's another one for you, which is bizarre. I'm fascinated by your take. So, a very common cure. I was told this by a midwife. She said, take a garlic tablet capsule, a little liquid thing. Take one of those a day, and it will help you with your colds. They won't be severe. You may not have any. And Joe and I faithfully took this for years and years and years. And she was right. We hardly ever got colds. So she was correct. Here's the little rub. I can't eat garlic anymore because my stomach doesn't like it, or ginger.
That's a shame. I have to say, I did come across one lady who was so obsessed with garlic. She was just reeked of garlic the whole time. Ooh. So she might not have had any colds, but she had no friends either.
Well, yes, sometimes a cold with a friend is better than never without. But yeah, we had garlic. We faithfully took it, but now I have to basically ignore ginger and garlic because although ginger is supposed to be great for the stomach as a bit of a alternative medicine, effectively at one level, I can't do that.
Yeah, and turmeric is, of course, very popular these days. Has all sorts of anti-inflammatory, even anti-cancer properties. I think medicine, and as I say, these things will go from being alternative to conventional medicine at some stage. But once the proof is in, and then of course you can take the ingredient and work out exactly the amount that's needed so that your tablets are accurate. And hopefully a little bit cheaper maybe than people having to buy them privately one day as well.
Now, here's the other thing about medication. If and you've clearly prescribed probably quite a lot of prescription-only medication over the years, ointments and lotions and injections and all different things and treatments, and a lot of those are controlled by doctors, and I'm really glad of that because you shouldn't be messing with them. Here's the thing: it's important to point out that even the humble paracetamol has side effects. For example, and this, I don't know, makes me laugh somehow in maybe a macabre sense, but it's some of the things that stop headaches that can have a side effect of headaches. I've got heart medication to slow my heart down, but it can cause other heart issues. And you think, did anybody think this through when you made it? Could you not have made the side effect not be the one thing you're trying to stop?
That's a good point, and it's interesting because you can take a drug. There are people who are intolerant to paracetamol, and which for the vast majority of people is fine. But I mentioned chloramphenicol earlier. My Heather's sort of loosely termed uncle took some chloramphenicol in South America many years ago and got a very rare side effect, but a deadly one called aplastic anemia, where the marrow shuts down. And I'm pleased to say with intensive care, he got better. But of course, not only could he not have any chloramphenicol, he wasn't able then to go abroad anymore because the risks were too great. And it's just, it's unfortunate that the medicines, whether they're alternative or conventional, aren't completely safe. And certainly that idea of, it's natural, it must be safe, is a total nonsense.
No, well, I was thinking about aspirin and willow, which is one of those bizarre things I heard years ago. If you don't have any access to any medication with you, if you find some willow, you can chew on it and it kind of acts a bit like aspirin. So, painkiller. Here's the problem. You can get splinters. It's wood.
That's nice. I might say one of the lovely things when I was working with the Maasai and literally in the bush is they if you went on a walk with them, they point out various plants which were terrific for the stomach or the headache or whatever, and alongside just sort of picking particular thorn bushes to use as toothpicks. When you don't have floss and toothpaste and you don't have access to paracetamol, etc., yeah, it's worth knowing what these plants are, but equally you need to get it right.
I mean, this is the thing. I take paracetamol if I absolutely must. I will have a raging headache for days and ignore it. It has to get really severe for me to take it because my body just doesn't like it. If I do have to take paracetamol, which is as rare as anything, I take the most expensive brand I can find. Something of the cheaper brands causes a more adverse reaction than the really posh ones. So I buy the really expensive paracetamol, which is... it hurts to buy, but if I buy the really cheap stuff that's like 20p for 30 or whatever, I'm in a bigger mess than when I started.
Yeah, well, that's wisdom.
Yeah, but it's making me think these are controlled products. They're made in laboratories with scientists who have beards and everything. Well, not the women probably, but they're so carefully made, and yet they have side effects. So when you're talking about natural products, well, I remember actually. Oddly, we went somewhere and found a coffee brand that was being promoted for the first time. And their selling point, their USP was every dose of caffeine is identical because we've made it so. Because even like posh coffees, you get more caffeine in one, less than the other. This coffee is always the same hit of coffee. So you're never going to have the highs and lows. I haven't seen it since that point. I think because that one, people probably don't care. When it comes to medication, however, getting the right dose, of course, that matters.
It does, absolutely. And I can think of other instances abroad when I came across dangerous plants as well as good ones, where the sap, if it gets in your eye, will give you a great deal of problem. Yeah. And of course, then you think about poisons and snake bites. And, the natural world is dangerous. It's out there. It's dangerous, as well as being very helpful. And that's why, you need to know what's good and what isn't.
Here's another one. Again, just sticking with paracetamol because it's one of the most well-known products in the UK, probably. So my son is not 16, my youngest son, so he can't have 2 paracetamols. He can have 1.5. Now, in about 4 months, he can have 2 tablets. I'm not quite sure what the difference is. I'm not being silly here, but between the day before his 16th birthday and not, but this is the point. It's a rough approximation of a dose, isn't it?
But the difference between 1.5 and 2 is very little. But in some of these, often there's I can't remember where I read it, but it was just sort of saying, if something is good for you, then taking more of it will be extra good for you. Well, then, I remember we were taught as medical students that explorers in the Arctic, it's funny what comes back to mind, isn't it? This is about 40 years ago, but explorers in the Arctic would eat what they could get hold of. And if they managed to shoot a polar bear, they'd eat polar bear liver. But it was stacked full of vitamin D, and vitamin D is good for you, but not in excess. It's very toxic in excess. So if you start chomping your way through a polar bear liver, you just need to be careful. Otherwise, you could do yourself some harm. The natural world.
Now, you mentioned your wife is on supplements. So one of the things I've heard about supplements is you do need to be careful because you can take too many supplements. You can, like you just said, effectively overdose on vitamins, for want of a better phrase, just coming back of what you just said. If you have too much vitamin D or E, and then I forget what the other letters are, what starts to happen? E and K. What happens? Because K is iron, isn't it?
Well, different things happen to each one, but there's many of the vitamins are water soluble, and you'll just pee them out.
Oh.
But ADEK, as I remember it, A, D, E, and K are fat soluble, so we store them in the body, which is fine in a sense because you don't, you don't run out so quick. Say if vitamin C runs out quickly, which is why sailors used to get scurvy because it's water soluble and you pee it out. But equally, the fat soluble ones, you store it and you keep on storing it, which is why the vitamin D in polar bear's liver is a bad idea. So yeah, it's good for us, but again, in certain amounts. So just be careful.
How do we? Because this has been a very interesting journey. Because alternative medicine, immediately you think, oh, weird people. That's just odd. But actually, a lot of the stuff that you were prescribing originally would have been a plant or a tree or something originally.
Yeah, absolutely. And then people realize, oh, look, that's useful. Yeah, that's useful. Penicillin discovered, through natural means. Useful. Good job it was. Well done, Fleming.
I love the mouldy toast one. It's like, I know we go on about this a lot because it always comes back to me, but I always think, how did someone think, moldy bread fixed a person?
Sure. Well, that's why they're brilliant scientists and we're not.
And I know we have this conversation, you and I, almost every week, it feels like, but yeah. How are we going to sum this up then? Alternative medicine. I know that one of the things they said was natural is good, question mark, effectively. It can be, it might not be. And then you've got to think about dosages, which are hard enough when you've got controlled medicines with active ingredients. But if you're chewing a willow bark and it's 1 inch or 2 inches, you've got a very different bark for aspirin. What does it mean to be healthy? To be honest, that is probably the most important question.
Mm-hmm. I think so, and I love what the way he tackled that. I wouldn't have thought of doing so, but in tackling that, it really made me think. You're absolutely right. We know what culture says is healthy. Glorious looking models, whether male or female. These are or sportsmen with massive muscles, but that's not what God says is healthy. It's our relationship to Him. That's all important because that's what lasts.
Yeah. This has been a really, my brain is now just spinning in 100 directions. Very good. If you've got any comments or thoughts on this, you can let us know. That's absolutely fine. But yes, let me go through the websites you mentioned. www.consumerlab.com if you want to know the real truth on supplements and whether they're really, really good for you or not, or doses and all that kind of stuff. Go there. And then you mentioned Alternative Medicine, the handbook. I think we have one like this, but I can't remember the title, which is quite good because sometimes I've thought, what is that thing I've just heard about? And then you look at them and think, yep, let's leave that one there. It is. CBT. I had CBT years ago, and there are various mental therapies, one of which my wife looked up and said, yeah, I wouldn't do that one. Go with the CBT because it's very biblically founded. It's about taking control of your thoughts. Well, the Bible says renew your mind every day, so that's a good thing. There was another one, I've forgotten now, and she said, yeah, that's not so good. Leave that one. Let's leave that one to side. It's not something you can find replicated in Scripture, so let's go with that. So, yeah, there's lots here.
Well, we can only ever sort of scratch the surface of a subject, but hopefully it gets people thinking.
Yeah, so, I mean, sorry, come back to your wife. So she's now taking another supplement. Is she finding it helpful, or is it one of these?
Collagen, it takes about a month before you see any improvement. So she's been doing it a week and a half, I think. But yeah, she really was bruising badly. To be honest, and I say this term and then run, it's old lady's skin. But it's the truth. That's what it is. But collagen can help, or it certainly claims to help. So we'll see. We'll give it a month or month and a half. And obviously, if it doesn't help, then she'll stop taking it. But all being well, it will make a difference. And then there we are. That's the way forward.
I will finish with this. You're a very brave man.
Well, as I say, at the moment I can still run faster than she can.
I'm saying nothing. Richard, thank you. If you've got any questions, comments or thoughts, you can let us know. Stuff in the news you've seen and you want some more information on, let us know. hello@pure247radio.org. hello@pure247radio.org. This week, alternative medicine. Genuinely fascinating. We're scratching the surface to perhaps a micron of depth, but it's interesting stuff. Thank you, Richard.
Most welcome.